Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual, and today we have some more rules in the clinical care tips category. Rule number 88, keep a small problem small. So this is a rule I actually heard from a surgeon, and I totally agree with it. It's actually a rule that is similar to other rules I speak about, such as rule number 4, less is more. And this is something that I feel very strongly about when I see a patient that has some kind of problem, but the problem is small to the patient, to the parents. I tell the parents that maybe it's just better off left alone. In other words, if it's a small problem to the patient, let's just keep it small. And an example I can think about is the patients that we see with umbilical hernia. A lot of patients, a lot of newborns develop an umbilical hernia shortly after birth. It's sometimes very big and can be kind of worrisome to the parents, and I think a lot of parents want to have it fixed. A lot of surgeons are tempted to get it fixed, but the current American Academy of Pediatric guidelines state that about 90% of hernias eventually close on their own, so if the child is not bothered by it, it's probably a good idea to keep it small and keep a small problem small and avoid any invasive surgery. If 90% of those hernias close on their own, and if the child has no pains, no symptoms, meaning it's a small problem, perhaps it's better off keeping it small and not doing anything, waiting for it to close on its own. And if it doesn't close on its own, by all means, you can go to the surgeon, have a little operation, and get it done. But if the patient has no issues, no abdominal pain, no discomfort, and it's purely cosmetic, meaning for them, a small problem, keep it small. Another good example for rule number 88 is the notion of a PO challenge for mild dehydration as opposed to IV access or IV fluids. If a child vomited only 1 or 2 times, vital signs look good. Again, I would consider this mild dehydration, and it's a small problem. How about keeping it small by giving some PO Zofran, maybe a PO challenge, and send the child home, as opposed to getting an IV, giving IV fluids, which will condemn the child for at least an hour, 2 or 3 in the emergency department. So, mild dehydration, small problem, keep it small. Another good example for this rule is current guidelines for tonsillectomy for patients with recurrent strep throat infection. So last I looked, the indication for tonsillectomy for patients with recurrent strep throat include patients who've had at least 7 episodes in the last year, 5 episodes per year for 2 years, or at least 3 episodes per year for 3 years. I would argue that if the patient is having strep throat, but it's not as frequent as those guidelines, it's considered a small problem. So keep it small by giving antibiotics and treat each episode, as opposed to a fairly invasive and somewhat risky surgery, aka tonsillectomy. And if the patient can tolerate the antibiotics, the infections are not that frequent, again, keep a small problem small. Why go to the OR if you don't need to? Now, on the other hand, if you have a patient that has fewer episodes than in the guidelines, but for that patient taking antibiotics is very difficult for whatever reason, maybe for them that problem is not small, and for them it's worth going to the OR and getting tonsillectomy. But if the patient has a small problem, keep it small. Rule number 89, evaluate your patient after every intervention. So this is something I think that we physicians and clinicians should keep in mind while the patient is in the pediatric emergency department, especially under our care. So oftentimes I put some orders on the patient, I give Tylenol for fever, I give fluids for dehydration, and it's not necessarily easy on a busy shift to remember to evaluate your patient after intervention. Specifically, you want to look for improvement after your intervention. So if your patient was dehydrated and you gave fluids, hopefully the dehydration is resolved or partially resolved, that tachycardia should improve. The overall status of the patient should improve. And if your patient got fluids and got worse, perhaps you need to entertain the possibility of more fluids are necessary, or maybe something is going on. Maybe we're missing something. My favorite example is those patients that we see every once in a while who come in with nonspecific symptoms, namely fever, maybe vomiting, just malaise and muscle pain. And it kind of looks like a viral illness, gastroenteritis perhaps. We give fluids. And I think it's important to keep in mind that if you gave fluids for such a patient, you really should look for improvement. If I gave fluid to such a patient and his tachycardia is worse, maybe this is a case of myocarditis. Maybe this is a case of pericarditis. Maybe something else is going on. So I think it's important to keep in mind rule number 89 and evaluate your patient after every intervention. Is the tachycardia improving after the fluids? Is the fever coming down after the Tylenol, etc.? Rule number 90. Remember the can't go wrong orders. I think one of the most intimidating situations for us, especially our trainees in the pediatric emergency department, is the situation of a crashing child. You walk into a room and there's a child who's ill-appearing, maybe seizing, doesn't look well, unstable in any way, or essentially any code or resuscitation situation. I can also recall as a senior resident dreading to be called for an RRT and what to do if I get called for a room with a patient that doesn't look right or is ill or seizing, etc. And it was very early on that I learned that there's some things you can do when a child is crashing in front of you or when the child is ill-appearing that you just cannot go wrong. I call it the can't go wrong orders. So if I walk into a room and there's an ill-appearing child, maybe looking septic, maybe unstable vital signs, maybe seizing, there's a bunch of things that I can say and do with the help of my team and my nurses that I can't go wrong. So if a child is ill-appearing and I walk into a room saying something like, hey nurse so-and-so, let's do the following. Let's place an IV, put the child on the monitor, give some oxygen, give an IV fluids and maybe check the glucose. I think in any situation when a child does not look well, any of those can go a long way and can only make things better. You can never go wrong placing an IV, giving fluids, oxygen, and check a glucose on any child that is ill-appearing. So remember, rule number 90, remember the cannot go wrong orders. And that is it for today, guys. Thank you very much for listening. I appreciate it. I hope you learned something. I hope you check the website and submit any feedback. I'd love to hear from you. Let's review what we learned. Rule number 88, keep a small problem small. If it's not a problem for the patient, keep it small and maybe just leave it alone. Rule number 89, evaluate your patient after every intervention. Did the fluids improve the overall hydration status? Did the Tylenol actually bring the fever down? Did the oxygen actually help the oxygen saturation, etc.? Don't forget, the patient is your patient as long as he or she are in the pediatric emergency department, even after you spoke to the admission physician. Rule number 90, remember they cannot go wrong orders. When you walk into a room and there's an ill-appearing child in front of you, you cannot go wrong by placing an IV, putting the child on a monitor, getting a set of vital sign, giving oxygen, giving fluids, check the glucose, etc. Remember, they can't go wrong orders. As always, thanks for listening, guys. Please check out pemrules.com, submit any feedback, and let me know if there are any topics you want to discuss in future episodes. I hope you like the Red Hot Chili Peppers. I hope you like Flea. This took a while to learn, and I'm playing my favorite instrument, the bass guitar.